Let's say like I'm not happy with the way my teeth look, or I think they're small, or I don't know, there's just something generally that I think are wrong with them, but I have healthy teeth. Could I then be a candidate for veneers?
Certainly, certainly. And veneers are a great way to improve the look of your smile if you feel like your teeth are short, if they're slightly crooked and you don't necessarily want to do Invisalign, or Invisalign might be a little bit of overkill for you. Sometimes the veneers will really solve that problem. They can take care of discolored teeth, broken teeth, chipped teeth, misaligned teeth that are not straight. I mean, there's so many things you can do with it to really improve a patient's smile.
What is the process for veneers then? Is it like a one appointment thing? Would I walk out with brand new teeth? Does that hurt?
With dentistry, the number one thing is making sure that our patients are numb. And when you're numb, you really don't feel much of anything at all. It's kind of like we allow women to have epidurals before they give birth, and that just makes sure they're as comfortable as possible. Dentistry is nothing like that. It's nowhere near as hard as giving birth to a child. I have 3, so I know it's nowhere near as hard as that. But we make sure that our patients are numb and comfortable. The nice thing about veneers is that you take away a lot less tooth structure for a veneer than you would for a filling or even for a crowns. It's one of the most conservative things in dentistry right now.
Wow.
We're talking about 0.3 to 0.5 of a millimeter of tooth that you're taking off. Like it's barely.
It's so little.
It's so little. It's so little. Most of the tooth remains intact. Usually what we do is we do a consultation with all of our patients, and we just kind of talk to them about the changes that they'd like to make with their smile. Like, do you want them longer? Do you want them shorter? Do you want them wider? Like, what is your vision for your ideal smile? And once we kind of cement that in place, we communicate with the lab. We take lots of photos, and we talk to the lab, and the lab gives us back something called a wax up. And the wax up is kind of like your dream smile test drive, right? It's amazing. And I'm able to kind of show the patients like, okay, this is what your ideal smile will look like. And then after that, we get started. And when you leave the office that day, you leave with a temporary veneers. And those temporary veneers, they look just like the test drive that we get back from the lab. So you're able to walk around with it for a couple days, show it to your friends, show it to your loved ones, get their opinion. And it's really great because that way we're able to communicate with the lab like, yes, she loves the test drive, go forward and make everything just like this. Or we're able to say, you know what, make the teeth a little longer or make them a little shorter. And then that very next appointment, we get back those final veneers from the lab, and then we cement them in. So most of the time, our patients are able to get it done in about, I want to say 2 appointments. The first appointment to begin, and then the next appointment for the day that we get the final ones back.
I like this idea of test driving though.
Yeah.
I didn't know that was possible.
It's amazing. It's amazing. So that way you're able to just kind of feel like what they look like and see, just make sure that everything feels and looks the way you want.
I know with other types of dentistry, like, implants, there's certain things you can and can't do or can't eat or things like that. Is there same types of care that I would need to know with veneers?
Not really. We just tell patients with veneers, like, you want to take care of them the way that you take care of your own teeth, right? Like brush, floss, and come in to see your dentist every 6 months. We want to be able to make sure we're cleaning well and keeping your oral hygiene up, and that just allows things to last as long as possible. We do tell patients with veneers the exact same thing we tell everybody that has any kind of dental work done. Don't chew rocks. Don't chew ice. Don't chew things that are not food, pencils, stay away from hard candy, just the same things that we tell every single person.